Good afternoon. I am Cindy Pineda, and I'm joined by my colleague, Les Becker, and we would like to welcome you to our presentation titled Creating Innovative Video-Based Education Using Human-Centered Design. Next slide, please. Les and I are both from MedStar Health, located in Washington, D.C., Maryland area, and I am the Associate Medical Director of our Continuing Professional Education Department and a Physical Medicine and Rehabilitation Physician. Les is a Senior Education Scientist for our Learning, Research, and Design Department at the MedStar Institute of Innovation, Simulation Training, and Education Lab. We do not have any disclosures. Next slide. Our first learning objective highlights why we did this project, and we will outline the rationale for the development of video-based education on bladder self-care management for people with spinal cord injury, their caregivers, and healthcare professionals. Next slide, please. The healthcare condition that we focused on in this project is spinal cord injury and disease, which we will refer to as SCID for short. This slide reflects the incidence, prevalence, and multifactorial causes of SCID. Spinal cord injury is a catastrophic condition that affects a number of systems in the body, which includes bladder and bowel function. Persons with spinal cord injury or disease must learn to adjust to and manage these functional impairments. Bladder self-care training is an important goal in spinal cord injury rehabilitation because it prevents secondary healthcare conditions which can cause significant morbidity and mortality. Next slide, please. The problems that we're trying to address were threefold. First, spinal cord injury patients are discharged from the hospital before mastering the skills of self-care management. We found that there is also inconsistent educational approaches by our healthcare professionals, and our patient education materials were long, dense, and complex. Next slide. Our literature review has shown that video-based education and the involvement of patient in the development of education works. This data has inspired us to further explore innovative strategies to design video-based education for our patients. Next slide, please. Moving to our second learning objective, this is to describe the design process of creating relevant and authentic video-based education using human-centered design. Next slide. Human-centered design is the understanding of human needs and how design can respond to these needs. The key feature in human-centered design is that the end user is involved in the content and design development. In this project, we adopted a model by IDEO, which includes three phases: inspiration, ideation, and implementation. It is important to note that this design feature is iterative in nature, which allows flexibility to refine ideas into solutions that work. After reviewing the literature, we found that this model has been used to explore solutions for different social problems faced by healthcare communities. Next slide. In the inspiration phase, the key component is empathy. The first step was to identify our primary end users, which were persons with spinal cord injury. We reached out to our Spinal Cord Injury Community Advisory Board and listened to their lived experience, their challenges, and learning needs through focus groups. In the ideation phase, we conducted brainstorming activities with members of our rehabilitation team, which include physiatrists, rehabilitation nurses, physical and occupational therapists, social workers, and psychologists. We also met with our learning design team, which include our instructional designers, our video team, and simulation experts to develop and design our prototypes. In the implementation phase, we tested our male and female prototypes and gathered feedback from both patients and healthcare professionals. Next slide, please. Now that you have gained a little insight on our design process, we will now transition to how we developed our videos. But before we do that, we wanted to conduct a quick poll as we were curious to know if you have collaborated with patients in planning, developing, and evaluating any of your educational activities. And we'll give you a minute to respond. Okay, I see that 15% said yes. And so take it away, Les.
Thank you, Dr. Pineda, and good afternoon, everyone. Now we transition to our description of the process that was utilized to create our educational videos. The bladder care management video that you will see shortly is part of a broader educational package, which was titled Discover SCID. The mnemonic is explained, or the acronym, I should say, is explained on the left-hand side of the screen. And this package was a blended learner approach to clinician and patient-facing SCID education, featuring simulation-based videos. Let's talk a little bit about the process. As in any educational process or activity, we began with goals and objectives. From the simulation side, we're accustomed to beginning with a learner action checklist. This learner action checklist ultimately morphed into a clinical screenplay, which we'll get back to in just a moment. We're getting a little bit ahead of ourselves. One of the first things we did was review the marketplace to see what type of urogenital trainers might be available to us, or did we have to create something? The next thing we did was assess task trainer suitability. So here's an early attempt that frankly was kind of embarrassing. The oval on the screen is highlighting a urogenital trainer that we found commercially. And in our very first effort, we placed it on the table and presented it to our consumer panel. And this approach on a table was soundly rejected. They asked us, how can someone possibly learn how to catheterize themselves from a model on a table? And they were right. Well, we still needed the urogenital trainer, and that was employed, but not on a table. What you're looking at here on the left-hand side is one of our sim men wearing the sling that we utilized to present the urogenital trainer in a natural position for our male actor. And frankly, he wore this under his first layer of clothing to allow us to produce the video. Well, that's what we did. So getting back to the process, we've already spoken about the clinical screenplay. We do have an in-house digital media services team. They're just awesome. We also were able to recruit SCID consumer actors and actresses. Our clinical team participated in all phases of the development of the screenplay, as well as the narrative voiceover, which was ultimately utilized. And intermediate products were reviewed by our consumer advisory panel. So, consistent with the human-centered design model, we wanted to ensure, or at least facilitate, that the idea that our education would be engaging. So a suggestion was made to create testimonials that would lead off each module. So here is an example of a testimonial.
Hi, I'm Chanel, and I'm a person living with a spinal cord injury. I'm glad you'll have an opportunity to view this educational module on bladder care. The module will provide information that will keep you safe. I'm really excited about this module because I didn't have this kind of resource when I was injured in 2009. This information is really important because bladder infections are the most likely reason you'll return to the hospital for emergency medical care.
Okay, let's move on. So now let's look at a demonstration cut of intermittent catheterization, male with full hand use. Here we go.
The following healthcare simulation is intended to demonstrate the steps associated with intermittent catheterization of a male with full hand use. The information in this video is intended to supplement instructions you have received from your healthcare provider. If you have any questions, concerns, or if any information in this video conflicts with the care instructions you have received, please consult your healthcare provider. Step 1. Gather the supplies you'll need. Your supplies will differ by catheter type, but should consist of hand soap or sanitizer, gloves, cleansing wipes, the catheter, and lubricant if needed. Step 2. Position yourself and manage your clothing. Move yourself in front of the commode or toilet and place your supplies nearby on a flat surface so that you can reach them. Position yourself right in front of the commode with your legs on either side and adjust any.
So that was our demo cut. The complete version of this video included all steps of the procedure. Let's move on to learning objective 3, discussing best practices to evaluate the effectiveness of video-based education. We evaluated the videos using something called the Patient Education Materials Assessment Tool for AV Materials, or the PEMAT AV. There also is a PEMAT for printed materials. This tool was developed under the auspices of the Agency for Healthcare Research and Quality, so it was available in the public domain. It includes subscales for understandability and actionability. And AV materials scoring greater than 70% are considered to be acceptable for use. We'll see how that works in a moment. We presented pilot videos to our spinal cord injury consumers and healthcare workers. Consumers and healthcare workers rated the pilot at 87% and 94% respectively for understandability, and 90% and 100% respectively for actionability. So thus we were confident of the value of our patient education materials. Future evaluation efforts may well include the Discern scale. This consists of questions that draw user attention to issues of potential bias, content currency, relevance, clarity, evidence, and balance, and the QRS scale, a statement-based quality rating scale on a scale of poor to excellent. This next slide shows a section of the understandability section of the instrument. And you can see from line 1 here, for example, the material makes its purpose completely evident. And then the rater can score it as 0 or 1 for agree or disagree. And there are various additional items. Similarly, the actionability section, excerpt here, and we start with row 20, the material clearly identifies at least one action the user can take. Again, the scoring proceeds. So now that you had an opportunity to learn a little bit about Discover SCI, we're going to present another poll. So the question is, in the future, will you consider collaborating with patients in planning, developing, and evaluating your educational activities? Yes or no? Wow, here we go. We started with 15 and 85, 15% yes and 85% no. And now we're up to 94% yes. So I'm delighted that you found this material interesting and that it may influence your future activities. Dr. Pineda will close us out.
Thank you so much, Les. Lastly, we would like to share with you some lessons learned. Bring in end users early. Engaging patients from day one and throughout the design of the video was key to the success of this project. Working with spinal cord injury patients behind the scenes provided opportunities for open dialogue, which was instrumental in the content and design of the videos. Engage your whole team and find out who your stakeholders are. Before project initiation, we identified the lack of standardization in bladder self-care education across professions. These educational videos were also offered to our healthcare professionals as continuing education activities to ensure that we were consistent in teaching bladder self-care to our patients. And lastly, as you develop educational materials, consider using human-centered design as activities involving patients reflects transformation and movement towards person-centered care, making education more responsive to patients' needs and healthcare education more relevant for all. Next slide. These are our references. Next slide. And we would like to thank Stanford Innovate Ed for giving us this opportunity and all of you for sharing your time with us. Thank you so much. This is our contact information if you want to connect with us.